Hi, I'm Dr. Jennifer Levine. I'm the newest member of the Bella Advisory Board, and I'm here to host this week's segment of Ask the Doctor.
Hey, Dr. Levine.
Hi, well, I am so excited to be here, and I'm so excited to have this opportunity to really be a resource to you and the Bella viewers. And I love the Bella tagline, "Beauty defined by you," and I really think, obviously, that's what I believe in. And
Absolutely.
I really want people to really be able to be their most beautiful self inside and outside.
If someone is thinking about, starting off small, say, and they've never had anything done, and they're a little bit hesitant, which I find with not all women, but some women my age in their mid-40s who are complaining about how they look, but they aren't sure if they should take that next step. What would you recommend as a great, I guess, entry procedure that they could try where they'd see a tweak, but it's not major surgery?
So I think it's really important for people to be informed and educated about all the procedures out there.
Absolutely.
And they need to choose, a doctor that's really going to explain to them what these different procedures are and what they do, and kind of see, where they're going to first put that toe in the water, because there's a lot of stuff out there. There's a lot of procedures. The market is very crowded. It's hard to know what to do, what's safe. So you really want to choose someone who has a lot of knowledge about what these procedures are, what they do, and then together you're going to make the decision about what that is. Maybe it's some Botox, maybe it's a laser. It's kind of what you feel most comfortable with. But
Absolutely.
We want to choose things that are safe, that work within your time constraints. So if you don't have downtime, you may not want to do a surgical procedure. But if you really hate your nose and the bump really bothers you, then surgery might be the best way to go.
Absolutely.
So you want to have a discussion. You want to be educated, and you want to choose the procedure that you feel comfortable with and is right for you.
Absolutely. And you actually just answered my next question is, what should people look for in a doctor? Really, that is step one, guys. It's all about finding the right doctor.
So obviously, you want a doctor. You want a doctor that's board certified, and you want to choose someone who's qualified in the field. So if you're doing plastic surgery, you want to go to someone who is a plastic surgeon.
Yes.
And the importance of going to a doctor is you're going to have a consultation. So you're really going to discuss not only what your goals are about the procedure,
Absolutely.
but also what the doctor sees.
Absolutely.
And then you want to have a physical exam. So you really want someone to examine you and kind of see your anatomy, the different asymmetries in the face or in the body, and really see what procedures are really going to enhance and bring out those qualities that you want. So I think that all of those things together will really produce the best result, and kind of.
It's true, though.
Yeah.
I mean, it's true. And really, I want to hit home with this because I've met people who have made the wrong choice because of, say it was $1,000 cheaper, whatever it is. Research your doctor, look at before and afters. I'm actually sitting in Dr. Levine's office. It's actually scary how it goes from the before to like model after with really just a few procedures. So, I mean, It really is amazing. Look at the pictures, look at their work, and I can definitely say Dr. Levine is pretty much one of the best I've ever seen.
Oh, thank you so much.
No, but it's absolutely true. It's all in the pictures. It's all in the office staff. It's all in the physician.
Yeah, it really is. It really is a team approach. I am so lucky that I have a great team of people that work with me, support me, and also support the patients.
That's right.
They're a great resource to the patients. Patients really are comfortable asking questions.
That's right.
What happens before, what happens after. I forgot to ask the doctor this.
That's right.
So you really want to have, of course, a great staff that's really going to enhance the patient experience and
Absolutely.
be a resource to the patient, like a real friend.
Exactly.
And you say, okay.
Where you're not embarrassed.
Right,
You could just
exactly.
Exactly.
And we want to have that kind of atmosphere where you really feel comfortable and you really feel free to express your concerns or
Absolutely.
issues, or say, what do I do about this?
That's right.
Because sometimes you just don't know.
It's so true. And I also feel that a woman knows a woman's body.
Yes.
and their feelings about, things. So I think that's a little bit easier, don't you?
I think it's a different approach because we as women, we've been looking at our faces in the mirror every day.
Yeah.
And we know, those subtle changes that we see, and we kind of know what bothers us more.
That's right.
And I think women also listen to other women. We really want to know what the problem is.
That's right.
And I think it takes a little bit of time sometimes to get the problem out there, because if we don't know what to fix, the chances of having a good solution are less.
Absolutely.
So I feel like it's really important, the listening aspect.
Yep.
And of course, those nuances, the balance, and of course looking natural is so important to women, not
Absolutely.
to look overdone, not to look like a cartoon, not to look weird.
Absolutely. To look like the best version of yourself.
Exactly.
Absolutely.
And when you feel that best version, it shows.
Absolutely.
That
it's so true.
confidence that you get from looking your best self really, really can't be replaced.
Absolutely.
And I am always so excited to be able to bring that to people.
Who is your average patient?
Well, we really don't have, we looked at our data, we don't really have an average patient. We see people who are in their teens all the way up to their 80s and 90s.
Okay.
But it's different procedures for different ages, obviously. But, people are really working longer.
Yep.
They're in the workplace. The workplace is really competitive.
Yes.
And people are, on their phones all the time, or they're doing videos, or they're doing selfies. So we have a different idea of how we look.
That's right.
So we're photographed more, so we're much more aware of those changes. And also there's so many more procedures to do that both will interfere with aging. So starting earlier may be actually preventative.
That's right.
And we also have a way to enhance the way that people look, so people get to choose a little more about how they want to present themselves to the world, which I think is so exciting.
Me too.
And we can stay relevant and we can stay beautiful for many, many years to come.
Forever.
Yeah.
That's my goal.
Me too. I'm working hard at that.
I'm like, well, you look fabulous. I'm like, woo-hoo. All right, ladies. So what is the biggest change you've seen in the field since you began? And is it a good or bad change, do you think?
Well, I think it's a good change. This is really, a rapidly expanding industry. And one thing that I really see is the interest in body contouring, because now we have a lot of non-surgical options.
That's
so
right.
before, where there used to be you could die and exercise, or you could have surgery, now we actually have options. And we know Americans are obsessed with their bodies, obsessed with fat, and we have great ways to reduce the fat. And now, because we're doing this more holistic approach where beauty and wellness have kind of melded together. So it's not just about how your face looks, it's also about how your body looks, how you feel. So we're seeing a real blending of doing the work on the inside, so we feel good about ourselves, and having our bodies and our faces kind of match that feeling inside. So that's what.
And you know what else? And I think it also works in reverse. If you look great, you feel better inside. It works both ways, I feel.
And I think that that's really important for people to understand, is we spend so much time working on the inside, and we feel kind of disappointed in ourselves if we still can't accept those that the outside doesn't match. And who says it has to?
That's right.
We can be beautiful outside. We can be beautiful inside. Being beautiful outside doesn't take away our great qualities inside. Right. So I think that we have to accept the fact that we could be gorgeous outside, we could be altruistic and helpful and all of those things all together, and they kind of feed off of each other.
Absolutely.
Right? Because the more energized and confident that you feel, the more good you can do.
That's right.
So look good, feel good.
That's right. That's our motto over here. Well, that was amazing, Dr. Levine. So thank you so much.
Oh, thank you.
I'm so excited.
I am so excited. And I would be happy, to really hear what kind of questions the Bella viewer
Absolutely.
has. And we're really here to be a resource for you. So I would love to, answer your questions, or kind of, if there's a problem that you kind of don't know what to do, we can talk about it.
Let's talk,
and
ladies.
Get some answers.
That's right. Open dialogue.
Yes.
Let's be real. Dr. Levine is here to assist all of us. And I'm excited about it. And also, definitely check back actually on December 4th, because we are going to be back here in Dr. Levine's amazing East 79th location, hosting a fabulous influencer and blogger event. We're going to be live. You're going to actually be seeing real procedures going on. You're going to get a taste of it. And you can ask any questions you want that night as well.